Hi there, I'm Dr. Carri. I'm a physical therapist and the owner of Recharge Therapy, and I wanted to tell you a little bit about why we do things the way we do. So, I've been a physical therapist since 2006, so you could do the math on how long that's been. And I've worked in a lot of different healthcare settings, and if you've been to traditional physical therapy, you probably were in a big gym, you were just given like a list of exercises to come in and do while you're there, and someone's just like checking them off the list, and maybe you spend 10 minutes with the actual physical therapist, and that doesn't work for a lot of people. It works for some people who just need general movement, but it doesn't work for a lot of people. And I see a lot of people with chronic pain, chronic pelvic pain, bladder issues where Kegels are not enough, and they need specific training, and the traditional system just isn't working for patients or providers. So at Recharge Therapy, we spend the whole hour with you, and often our first visit is 90 minutes, and you're gonna spend it with me, the physical therapist, the entire time. Like, we're not in a big gym with a bunch of people, it's one-on-one, me and you. And our follow-up visits are an hour usually, and for that reason, I can spend time listening to you. Your story is important, and that gives me clues, and it's helpful to the whole process. So we do things differently. You're going to be in a private treatment room, one-on-one. We have a gym equipment and gym space to work on exercises, and I mostly work on pelvic floor issues, pelvic pain, bladder issues, prolapse, bowel issues. And I really love having the gym space available too, in case we need to work on some general exercise or get you back to exercising. I really love combining like pelvic floor therapy and sports ortho stuff. But I also see people with chronic pain, with orthopedic injuries like shoulder pain, back pain, knee surgery. So that's just a little bit about how we do things differently, and so you're going to spend one-on-one time with me the whole time, and the trade-off is you're probably going to get better faster. Like many of my patients come for 3 visits, 6 visits. You know, if it's chronic pain, it's going to take longer, but most people come once a week to start with, and then they taper off to every other week. So you're going to get better faster in less visits, and I'm always going to try to give you a few simple things to work on at home. And also the first visit, it's 90 minutes, so that not only can we hear your story and do an assessment, but we'll give you treatment that first day. So I hate when I go to a physical therapist or any healthcare provider and the first session is just an assessment, and then you got to come back next time to get treatment. It's like, what did I just spend this time on? And obviously as a provider, that's important to get an accurate assessment and a thorough assessment, but also as the patient, like, I want to get treatment the first day. I want to like start the process. So we incorporate that into our first visit, and that's why it's a little bit longer, because we need to hear your whole history, your whole story. We need to do a thorough assessment, and then we want to start treatment right away and give you some simple things to work on. So I hope that helps give an idea of what we do and how we do it and why it's a little bit different.